Speaker, my question is to the Minister of Health and Long-Term Care. Last week, I asked the Minister about threats by Cancer Care Ontario to cut all cancer surgery in Windsor due to an escalating dispute regarding thoracic surgery. The Minister brushed off my question and refused to intervene or to promise the uninterrupted continuation of these services in our home community. Speaker, Windsor and Essex County residents do not take lightly threats to our health care services, and neither do I. So I ask again, will the Minister act immediately to protect cancer services in Windsor and Essex County?
Well, Speaker, thank you for the question, and the member from Windsor West has, she and I have spoken about this issue on several occasions because she is determined to do everything she can to provide the highest quality care for people in Windsor, Speaker. Cancer Care Ontario has changed how they determine what level of hospital should be performing surgery, Speaker, for specific conditions. So in this particular case, for this kind of surgery, they've set a threshold of 150 surgeries. The evidence is very clear. Mortality rates have been cut in half as a result of the quality improvement initiatives that Cancer Care Ontario has put in place. I want every person in this province to have access to the highest quality care. That does mean sometimes consolidating so that volumes deliver the best outcomes.
Thank you.
That's an unfortunate response, Speaker. Today, Doreen Gravel, a 75-year-old Windsor woman who is both a cancer survivor and a patient, is staging a sit-in at Windsor Regional Hospital. She's there today to send a message that care close to home is indispensable for both patients and their families. This brave and ill woman is doing all that she can to protect services for the people in her community. Can the Minister tell this House why she has not felt the same obligation as Mrs. Gravel to stand up for Ontario patients?
A big win for local health care services here in Windsor and Essex County as Thoracic Care Cancer Services stays right here at home. And here to talk more about this issue is Taras Natyshak, the Member of Provincial Parliament for Essex County. Taras, always great to see you, and thanks for being here today.
Thank you, Kevin. Great to be with you.
Great to be with you too. And I understand that this was a personal issue that you were personally passionate about that. So can you tell me why you were so concerned about this issue?
Well, I don't have to tell anyone of your viewers that cancer certainly is an issue in our area that has touched almost every family in one way or another. We know someone who has been affected by one type of cancer or another. So it's an issue that hits close to home in Windsor and Essex County. But predominantly, what really infuriated me and the rest of our community was a threat by Cancer Care Ontario to eliminate a whole host of cancer surgeries or services that weren't associated with thoracic care if our hospitals, Windsor Regional and Hotel Dieu, didn't conform to the directive by Cancer Care Ontario to completely eliminate thoracic surgeries and move them to London. That was a real and present threat that was levied against our community that would have lowered the level of service and care that our region deserves and needs. So it really got me enraged, and it got so many people up in arms that we would be threatened in this way. And Kevin, I can only tell you that of all the issues I've ever been associated with, even before I was the Member of Parliament, this issue here galvanized our community like no other. People came together and they were ready to fight for the care that we need.
And I also understand that a lot of grassroots effort went into this issue within the community. So can you tell me how proud you are about the involvement of our local community with this issue?
Yeah, I guess that's what it takes on any issue is a consolidation of vocal people who are ready to stand and to fight for what's right. And we saw that in numbers that, again, I've never seen before. I put an online petition out there to gather signatures in support of retaining cancer care, thoracic care in our region. And in just under a week, we had close to 8,000 signatures on this petition. We organized a public meeting at the Vollmer Center in LaSalle. It was attended by over 300 people who were just passionate and ready to do whatever they needed to do to maintain cancer treatment in Windsor. Thirdly, one of the most important components of the victory was that our local media played an enormous role in broadcasting that message and informing people about why it was so important to maintain cancer care in Windsor. And what happened was the Windsor Star really played an enormous role in this. Brian Cross, who is a journalist there, was relentless in his pursuit to really highlight the injustice that was happening to our community. And it goes to show you that when our region comes together around an issue, we're really unstoppable. And it forced Cancer Care Ontario, and by extension the Ministry of Health, to reverse their decision. We clearly showed them that we were not going to take anything less than fair treatment when it comes to healthcare services in our region.
We've talked about the human element in terms of the connection it had within the community. So I want to touch on the importance from a healthcare perspective and what this means for our local healthcare officials in terms of retaining the staff or the physicians that they have here locally, and the importance that it has in maintaining a high quality of care here in Windsor and Essex County.
Well, what it does mean is that we, instead of having those surgeries performed in London with what I'm certain are well-qualified and professional thoracic surgeons, we maintain our home surgeons, our Windsor-based surgeons who provide an incredible level of care, who have very good, or if not better, patient outcomes than anywhere else in the province, and they're able to continue their practice. Now, let's not forget, doctors still need to make a living, and if thoracic cancer surgery, which makes up a bulk of their practice, is eliminated from their practice in Windsor, then they can no longer afford to simply work on other other issues, other healthcare issues within their practice. So it means that they will be here. It means that we'll also have opportunities through the medical school to continue a partnership through our Windsor Regional Hospital and through those clinicians to be able to offer a pathway through the medical school into potentially thoracic cancer care when those medical students do their intake here.
And also, in terms of Cancer Care Ontario, during the fight to maintain thoracic care services here in Windsor and Essex County, you were very vocal about your disapproval of the way Cancer Care Ontario was handling the whole thing. So your colleague, Minister Matthews, also said that there's still plenty of work to do here in Windsor and Essex County in terms of the level of health care and cancer care services here locally. So I'm just wondering your thoughts on that whole premise.
Well, there was a little bit of doublespeak that came out of the ministry, and from the perspective of Cancer Care Ontario, they're an outside agency, a third party that really is mandated by the Ministry of Health, but operates exclusively. They're still connected, but what we have to remember is that the buck really does stop with the Minister of Health, and when it comes to retaining healthcare services or promoting, enhancing, and ensuring that the resources are there, it's our Ministry of Health and the Minister of Health that has the final say on that. What I would say to residents of Windsor and Essex County is that we should never let our guard down when it comes to thoracic surgery or thoracic cancer care or any other healthcare service, because we've seen how easily decisions can be made that are detrimental to our community. So we have to be ready to stand up for each other, for our healthcare services, and to enhance it too as well.
So finally, what would be your final parting message to the people here in Windsor and Essex County about the future of not only thoracic care services here in Windsor and Essex locally, but sort of a more broader scale of the healthcare system regionally here in Windsor and Essex?
Well, one of my final messages to our community would be thank you. Thank you for showing me that we can come together and we can fight for what's right, and we can protect services for our neighbors and our friends and our family members. I would say that there are efficiencies that certainly can be made within the healthcare system, but our number one priority should be maintaining and enhancing access for all residents of Ontario. Access doesn't simply mean you can get that service somewhere else in the province. Access means close to home, within your sphere of support, and quick and speedy access too as well, timely. Those are things that go towards enhancing the quality of care. And they go toward the metrics of ultimately curing and helping people get better. And that's what ultimately our healthcare system is designed to do, is to care for people and ensure that patient outcomes are as good as they possibly can be. That means keeping them close to home where they can access services in their own home communities.
Well, Taras, I thank you for your work on this issue and certainly for joining me today. Thanks, as always, for your time, and we'll see you next time.
My pleasure. Thank you, Kevin.
For the News Blitz, I'm Kevin McShann.